Hello, parents and Kiara. Today we are going to discuss about the pink eye or conjunctivitis for kid. What is pink eye? Pink eye is an infection that is called conjunctivitis. It's common in young kids, usually contagious and breaks out can swap through preschools and playground. But even teens and adults can get that. Pink eye is an inflammation of the conjunctiva. That is the white part. You can see the white part of our eyes and and the inner eyelid. It is a minor infection, although it may look very bad. But usually it is not stay serious. Still, if your child shows sign of pink eye, you have to contact a doctor. Some of them that goes away without much treatment, but sometimes they need treatment. What are the causes of this pink eye? There are different causes of infection of um, this eye. Can be bacteria, can be viruses. The surrounding area if inflamed, like ear infection, sinus infection, throat if infections, all that gone. Sometimes it can be caused by some sexually transmitted disease also. So some kinds of pink eye also non-infectious, like allergic, when it is triggered by grass, pollen, animal dander, and dust mite. Okay, so that are also an irritant that is caused by some irritation, can be chlorine, can be air pollution, all these things. Now, in newborns at risk of pink eye can develop serious health problem if it is not treated. If a pregnant woman has sexually transmitted disease during delivery, the bacteria and virus that can pass from birth canal into baby's eyes and causes pink eye. To prevent this, usually doctor gives antibiotic ointment or eye drop right after birth. Occasionally, treatment causes mild chemical conjunctivitis, usually clears up its own. Doctor also can screen pregnant women for sexually transmitted disease and treat them during pregnancy so that it not spread to the baby. What are the signs and symptoms of pink eye? Besides, it looks very red or pink. Eye discomfort is very common. So child can tell you there is something sand inside the eye, and some discharge can come, some pain and swelling of that white part. Some can have the swollen eyelid, and they can have sensitivity to bright light. And pink eye can affect one eye or can be both eye. Is it contagious? Of course, is contagious if it is caused by bacteria or virus and spread to others as soon as symptom appears, and as long as there is discharge from eye and until 24 hours after the antibiotics are started. And pink eyes that caused by virus generally contagious before symptom appears and can remain as long as the symptom lasts. And allergic and irritant conjunctivitis are not contagious. So by touching, you can, that is from the infected person, it can be transmitted. So also the things that is used in the eye, like tissue paper or things, can also spread this. And if pink eye can spread, the kid swim in contaminated water and share contaminated towel. By coughing, sneezing, it can also spread. So basically, also pink eye one can spread by to other eye by rubbing and touching the infected eye and touching the other eye. It can transmit from one eye to another eye. So how can you diagnose it? So basically, if you think that is pink eye, it looks like pink eye, so you have to go to doctor. Okay, so it is really important to how it is treated. Bacteria usually we doctors give you antibiotic eye drop, It is hard to tolerate eye drops several times a day. So put the drops inner corner of the child's closed eye, and then child can open the eye. Medicine usually flows into it. So in this way, if your child are allergic type, then anti-allergic medicines are given. Um, Now, how can you, as a carer, can help them? You can give a bit of cool and warm compress on the eye that make your child feel comfortable. Clean the edge of the infected eye carefully with warm water. The gauze or cotton ball helps them. It can also remove the crust and dry discharge that can cause stick together eyelids in the morning. And if the child wear contactless, may recommend that should not be worn until infection is gone, and disinfect the lenses and storage cases at least twice before letting child wear them again. Okay, so if this child wear disposable one, throw away current pair and new pair you can use. Okay, so usually it is recommended, uh, it is contagious, so stay out of school, childcare, summer camp. Can it be prevented? So of course, highly contagious. Wash their, child has to wash their with wash their hands, warm water and soap, and should not share their eye drop, their tissue, their eye makeup, washcloth, towel or pillowcases. And of course, as a carer, you have to wash your hand as well after touching the infected eye of child, and throw away gauze cotton balls if they using, or wash the towels and linen the child has been used in hot water separately from the rest of the family laundry to avoid contamination. Um, so pink eye, if even if after you see the doctor and not improving in 2 to 3 days, um, so it is better to see again. Yeah. And if there is of course swelling, redness, tenderness of eyelid and surrounding eye area, plus fever, so you have to go immediately maybe to the emergency because you need more treatment that time. Hope this helps about eye infection, pink eye. We will come to another topic next week. Bye bye for today.